Hi everyone, Dr. Iadeluca here. I'm over at our Harbor Creek office shooting a video to show you a little bit about what we do when we evaluate the patients to figure out what's wrong with you. On the first day, we really want to understand, why are you hurting? What happened? What's wrong with you? And so after we do an examination, most oftentimes, we'll take some x-rays so we can see what's going on with the bones on the inside. You know, to see is to know, and not to see and just feel with your hands is kind of to guess. We want to see how your x-rays look, and so we don't guess. We'll take x-rays. This is our x-ray tube right here. So we'll line you right up against this box here. Chiropractors typically take x-rays standing because we want to see how your posture looks as well. Our medical colleagues usually lay you down and we'll take x-rays in laying down position, but that kind of takes away the posture pictures. And so as long as the patient can stand, we'll shoot the x-rays standing. So we're going to take x-rays of you, and then we're going to come on over here and we're going to compare them to a posture picture. Just like in the x-ray, we're going to shoot a posture picture from the front and then one from the side. And we're looking for forward head carriage, shoulders rolling forward. Of course, no one's going to be wearing a jacket so we can see. Now we want to see how you line up. We put a grid behind you to keep the camera level. And actually these days we use an iPad which levels itself with the earth, with the magnets, I guess, in the iPad. But that keeps you level. And then we can see exactly how you line up. And then our doctors can compare how do the bones look on the inside on the x-rays that we can pull up, and we have those on the other side of the room, and compare those with how your posture looks. So they're really sitting there and they can see exactly how the patient stands from head to toe. Globally, we can see the whole forest, and then when we want to see just a vertebra or two, exactly what's going on right at each segment level, we can see that on x-ray. And so that's what we do in our clinics. We kind of compare that, and then we'll sit down with the patient and recommend the right kind of treatments, whether it's adjustments, decompression therapy, the right kind of exercises, laser therapy, or particular supplements that may or may not help you. So, but that's a little bit about what we do over here, and we do it at all 4 of our clinics. All right, thanks so much.